Thank you for joining. We'll be starting in just a few moments as our final attendees arrive. Hello, everyone, and thank you for joining us via this webinar platform or via the live streaming on social media for this event hosted by Nexdigm with support from the Consulate General of India, Chicago, and in collaboration with the US-India Business Council and outreach partner Medicall. This webinar is part of our series, Diversify to Differentiate, Think India, Think Next. Today, our focus is on the opportunities available in India's robust healthcare sector. I am Mark Lessem, and I'm going to be your webinar moderator today. Before we begin, please note that you are in listen-only mode. If you have any questions, please share them with us through the questions box on the control panel at any time during the session. We will address your queries at the end of the webinar or in writing afterward if time runs short. India's healthcare landscape is evolving rapidly. Extensive policy interventions designed to enhance healthcare access to India's large population have been recently adopted. One of the most prominent reforms is the Ayushman Bharat initiative, which aims to extend healthcare access to the economically disadvantaged. This presents sizable opportunities for individuals and businesses alike who are seeking to invest in India. It's my pleasure now to welcome our distinguished panel of guests for our session later today. We will formally introduce each one shortly. Honorable Dr. Indu Bhushan, Consul General Amit Kumar, Sarthak Ranade, Rakesh Chitkara, Samuel Brilliant, and Ravi Menon. Thanks to each of you for joining us today. We look forward to your valuable insights. I'm going to get things going by setting the context for today's event, highlighting some of the opportunities in the Indian healthcare ecosystem, and providing a brief overview of the Ayushman Bharat initiative. This will be followed by the panel discussion with our esteemed guests before we open the floor for the Q&A session. First, a brief comment about my background. At Nexdigm, I help lead our business development efforts in North America. I have over 35 years of operational leadership experience in a variety of functional areas, primarily in the medical device, pharma, and hospital distribution industries, with companies like Medline, B. Braun, and American Hospital Supply. Enough about me. Let's get started by evaluating why global industry leaders are thinking of investing in the Indian healthcare ecosystem. India's healthcare sector is large. In fact, as you could see, over the next 5 years, it's expected to more than double to almost $400 billion. The private sector has emerged as a vibrant force in India's healthcare industry, accounting for almost 74% of the total healthcare expenditures. Overall, a total of $200 billion is expected to be invested in medical infrastructure in India by the year 2022. The healthcare sector is comprised of healthcare delivery, pharmaceuticals, medical devices, and diagnostics. It has been attracting sustained foreign investment for the last 2 decades due to its strong fundamentals and huge untapped opportunity. The reasons for this compelling growth include rising awareness, increasing disposable incomes, and the expansion of both private and government healthcare coverage, which results in more affordable and accessible healthcare services. The right side of this slide gives you a bird's eye view of the major pharmaceutical and medical device clusters that India has to offer. Now, looking at the impact points on the far right portion of this graphic, we can see some of the things that we've previously discussed that are driving the center section, India's growing healthcare sector. Because of these impact points, the already attractive industry is expecting strong growth due to factors such as the increasing prevalence of lifestyle-related ailments, changing demographics, and rising life expectancy. Growing consumer awareness, increasing income, and affordability are resulting in higher demand and utilization of healthcare services. And with all of this in mind, the Indian government has made it much more attractive for healthcare investment with new and expanded facilities. The healthcare industry is also witnessing the emergence of secondary and tertiary sites, which are driving demand for medical devices. Companies with a strong product pipeline, wide hospital reach, and quality infrastructure will have the edge over their competitors and be in much better position to capitalize on their intrinsic value proposition. Now, the healthcare ecosystem in India is navigating large-scale structural reform. The most significant of these is the PMJ, launched in September 2018, and which was formerly known as the National Health Protection Scheme under the Ayushman Bharat Initiative. Positioned as a game changer, PMJ will make healthcare available, accessible, and affordable to India's population. In short, PMJ promises to provide insurance coverage for more than 500 million people who are economically disadvantaged. It provides insurance of up to approximately $7,100 per family and covers inpatient hospitalization expenses for secondary and tertiary care such as surgery, medical treatments, medicines, and diagnostics. Over 1,500 procedures are covered. There's no limitation on family size or the age of beneficiaries, and it uses a cashless and paperless procedure for claims management. Industry leaders expect that this will increase demand for both medical devices and pharmaceuticals due to the significant increase in accessible patient population. This increase would best benefit the segments and therapeutic categories you see here on the right of your screen. Since its launch 2 years ago, PMJ has achieved tremendous results. There have been approximately 11 million beneficiaries and approximately $2 billion in claims which have been filed. So let's see how Nexdigm might fit into the equation. Nexdigm is an award-winning, employee-owned global business advisory organization that's been supporting foreign direct investment projects into India since the late 1990s. We understand this space very well and have helped businesses from over 50 countries establish and expand their local presence. In the United States, we are based out of Chicago, and we provide multifunctional and digital capabilities across business consulting, business services, and professional services as we assist our clients with integrated solutions to their complex challenges. While Nexdigm is industry agnostic and we work with a vast array of businesses, we have broad expertise in the healthcare sector, and we've worked with several leading healthcare multinational organizations. As a thought leader, and in collaboration with AdvaMed, we authored the Medical Devices Industry in India publication. We also published a special report on Ayushman Bharat titled India's National Healthcare Protection Scheme, and presented a panel on the growing opportunities in affordable healthcare in India at AdvaMed's MedTech conference in 2019. Over the last 57 years, our teams have designed and specialized our service portfolio to support global businesses in their India entry and establishment journey, expansion strategy, business optimization, and regulatory compliances, among others. This slide provides a snapshot of our multifunctional capabilities. Now I'm going to take a break now and ask you to do a little bit of work, very little, I promise. I invite each of you here today to select the single best answer that reflects your current intent. How important is India for your company as a growth market in the next 1 to 3 years? Please choose the answer that best represents what's relevant for you, very important, somewhat important, or you're in the exploratory stages. And as you tally your answers and we wait for the poll results to show, I'd like to remind you to submit any questions you have during the panel discussion using the control box. And again, we will address as many questions as possible. Well, this is no surprise, and I'm pleased to see that a large majority of us on the webinar here today feel that India is very important to our future strategy in terms of our growth, 82%. Boy, it doesn't seem like anybody is not interested. So we've got a very invested audience, and I appreciate your involvement. It's now my pleasure to introduce the moderators for the panel discussion today. Sam Brilliant is a senior global business advisor at Nexdigm. He's an accomplished financial leader with over 43 years of experience in the healthcare industry. He's held CFO and VP level positions in the areas of strategy and finance at major US-based multinational corporations, including Hollister, Baxter, American Hospital Supply Corporation, and Applied Immune Sciences, and Amersham International. Ravi Menon is a senior business advisor for Nexdigm's healthcare sector in the Asia Pacific region. He holds over 38 years of experience spanning international markets, including India, Southeast Asia, Greater China, South Korea, and the Middle East in the pharmaceutical, medical device, and consumer product industries. Ravi, the virtual podium is now all yours.
Thank you, Mark. It is my pleasure to introduce our distinguished guests for today's session. First, the Honorable Dr. Indu Bhushan is the Chief Executive Officer of Ayushman Bharat. And as you've just heard, the PMJ program is the world's largest government-funded health assurance scheme, providing cashless secondary and tertiary care to more than 500 million underprivileged citizens. A civil servant turned economist with a career spanning nearly 37 years, Dr. Bhushan is a former Indian Administrative Service officer. He has served as Director General East Asia Department of the Asian Development Bank in Manila and Philippines. And he is the recipient of many prestigious awards, including the Government of India's National Award for E-Governance in 2019-2020, where he won the Gold Award, as well as the Global Achievement Award by Johns Hopkins University, his alma mater. The Honorable Amit Kumar is a career diplomat who joined the Indian Foreign Service in 1995 and is currently the Consul General of India in Chicago. His widespread experience includes holding diplomatic positions in the Indian embassies in Washington, D.C., Tokyo, Beijing, Berlin, and Ankara, as well as working in the Ministry of External Affairs in New Delhi. He has dealt with both bilateral and multilateral work in diverse areas such as political, strategic, and economic spheres. Mr. Sarthak Ranade is the Managing Director of Janssen in India, and he oversees the company's operations in India and the South Asian markets of Sri Lanka and Bangladesh. He is a member of the Johnson & Johnson India President's Council, as well as the Janssen Asia Pacific leadership team. With over 20 years of experience in the pharmaceutical industry, Mr. Ranade has worked with industry leaders, including Janssen India and Japan, the J&J Group, Wockhardt, and Ranbaxy. He is a very respected industry leader and currently chairs the Pharmaceutical Committee of the American Chambers of Commerce, AmCham, in India, and is a member of the Organization of Pharmaceutical Producers of India. Mr. Rakesh Chitkara is the Senior Director, Global Government Affairs at Abbott Healthcare India, and is also the co-chair of the Life Sciences Committee of the US-India Business Council. Mr. Chitkara is a seasoned professional with over 36 years of experience of working with US-based multinationals in leadership roles spread across government and public affairs, public policy, government transactions, and crisis communication, among many others. Before Abbott, he has held senior management roles in leading multinationals, including Monsanto Chemicals, Rohm & Haas, Dow Chemical, and General Electric. In his illustrious career, he has supported new investments in multiple manufacturing and R&D activities across many states of the country. Thank you all, gentlemen, for joining us today.
Good day. Thank you, Mark, for setting the context so aptly for our audience, and to Ravi for introducing the distinguished panel. Let us now begin the much-awaited panel discussion.
Thank you, Sam. My first question is for Dr. Indu Bhushan. Doctor, now that we're all well acquainted, I would like to direct the first question about the PMJ program. We would like you to explain how the PMJ program has changed or evolved the healthcare ecosystem in India.
Thank you very much, Ravi, and thank you very much for inviting me to this forum. I am CEO of National Health Authority, and we implement Ayushman Bharat Pradhan Mantri Jan Arogya Yojana (PMJ). But we have also started to implement recently what we call National Digital Health Mission. So I'll speak about PMJ and how that is changing the landscape or ecosystem in the health. But I'll also give you a brief preview of National Digital Health Mission because it also has huge implications for business opportunities in India. So buy one, get one free. I'll talk about both these schemes, and both of these are actually very flagship country. On Ayushman Bharat PMJ, I think background was given. The reason that this scheme has been put in place is that large proportion of people in India don't have access to curative care, and when they have to seek curative care, they have option of not using it because they can't afford it, or borrowing or selling their assets. And so there are some studies which show that about 60 million people every year fall into poverty because of expenditure on health. So this scheme has been put in place to prevent that and to ensure that no one gets impoverished or goes into deeper poverty because of expenditure on health. Now, if you compare the healthcare seeking behavior of poor people as compared to non-poor, it's like a cheese and chalk, because poor people usually rarely go to the hospital, even if they're sick. Their use of services is about 1/3 that of the at the same go to public sector, private sector is almost out of their reach. So if we can ensure that whatever financial constraint they have, that can be met, and their healthcare seeking behavior doesn't become like those of top 20%, but at the average level, then we are looking at about 10 million new hospitalization every year in the country. So these are 10 million hospitalization or 10 million cases of people going to hospital, which was not existing earlier. At the same time, you would see a lot of people shifting from, say, public hospitals to private hospitals, because earlier they couldn't afford private hospitals. So of those people who are going to public hospitals, these are also about slightly more than 10 million. So we are looking at a huge demand for services, healthcare services, both in public sector and private sector. And it has, of course, huge implications for the whole healthcare supply system, whether they're pharmaceutical, diagnostic services, direct services, so and what have you. So in the last 2 years, because the scheme was just starting and there is always a startup, we have, as was presented earlier, we have provided support to or hospitalization services to 11 million people. And when the scheme stabilizes, it will be about 10 to 11 million people every year, and it will grow. And we have out of 36 states and UTs, 32 states and UTs are on board. And we're hoping that the remaining 4 will also join. With them joining, it will become truly a national scheme, one nation. And again, one of the key features of our scheme is portability. And portability implies that they can take the benefits wherever they go. They are not bound by the states who are paying for these services, and that will be further strengthened when everyone is on board. So we've had a great start so far, and the momentum is building up. So the scheme, which was put in place to prevent impoverishment because of health condition, actually has proven to be a big disruptor in the healthcare system, because it's a demand side financing rather than supply side financing. And with this demand side financing, incentive structure, both at the level of hospitals and providers, is changing, and greater services are being provided to poor people. So in that sense, the change in priority of hospitals and doctors, and that is already visible in terms of changing of the ecosystem. Now, coming to the second part, which is a National Digital Health Mission. As some of you may have heard that government has announced a series of steps for dealing with the COVID crisis so far. And one of them was to announce National Digital Health Mission, which is going to be, which has been is being implemented by a National Health Authority. And that also, in terms of creating that digital nation, we have IDs given to all doctors or hospitals and all people. More than 1.3 billion people is the goal that we have, and creating electronic medical records, creating PHRs, personal health records, and ensuring that doctors have access, and we have consent manager. So there's a huge amount of thinking and work being put in place. Again, offers a huge amount of opportunities for IT firms, but also telemedicine and other opportunities. So we've started this work about 4 weeks ago, and as we go forward, we'll have more to share on this National Digital Health Mission as well. So I'll stop here and come back if you have questions on either of these. Thank you.
Thank you, Dr. Bhushan. Just one more question to you, and thank you for that very interesting perspective on the National Digital Health Mission as well. And I think the audience would be really interested to know about that. Now, you did mention that the demand side is greatly benefited by the PMJ program. So, are there any specific sectors or areas, where of products and services where you think there will be a major impact in market opportunity for our audience? So, they will a lot of them would be from the supply side. So, are there any areas that you would like to highlight in terms of the market opportunity?
Well, market opportunities will exist in all sectors of health, because one of the key constraints that we have in terms of providing services and the additional 10 million hospitalization I mentioned is that we don't have enough hospitals. We don't have enough supply of hospitals, especially in tier 2 and tier 3 cities, where most of this demand is now coming from. So all major specialties need more hospitals, more supplies, more diagnostic centers, more, of course, pharmaceuticals, more data analysis. So here you pick up any sector, I think all those sectors are going to be increasing. And in India, I think we are spending right now very little on health, public health, only 1.2% of GDP. And our national health policy of 2017 commits us to more than double it by 2025. And this current crisis, this pandemic, has given us, I think it has spurred that thinking. And I'm more than sure that we'll be increasing government funding. And this government funding, we found, does not crowd out private sector funding. Actually, it helps catalyze greater funding by the private sector. The needs in India are so great that public funding, even if we double it, will not be able to meet the demand. And all the factors that were presented just now, increasing income, increasing awareness, urbanization, changing age structure, all of those imply that demand for services, health services, is continuously going to increase exponentially. And so all sectors of health would need to be ramped up. So if you are involved in health sector, I can assure you that you are in a sunrise sector as far as India is concerned.
Thank you very much, Doctor, for those comments. Most helpful. Before we get to our industry guests on the subject, I would like to invite Mr. Amit Kumar to share some insights on the current India-US commercial and economic relationship and his view as to how this impacts the healthcare sector. Mr. Amit, not muted.
Thank you, Mr. Menon, for those words. Let me start by giving a very brief overview of where India-US commercial relationship stands today. We had a bilateral trade of $150 billion last year. And admittedly, there has been a bit of a slowdown this year due to COVID-19. But there are studies which show that there is potential to grow our bilateral trade to around $250 billion in the next 5 to 7 years. And the factors that propelled growth in our economic trade and investment ties in the past few years continue to remain relevant. So I'm fairly confident that we will soon see an upward trajectory in our trade and investment ties. You would have heard of recent announcements by major companies like Google, Facebook, and several other foreign entities, including the Saudi Arabian sovereign fund from Samsung into our IT and manufacturing space. I think this reflects both confidence in the potential of the Indian economy, as well as I think it is a testimony to the concerted push by government to carry forward the economic reforms process. What the current pandemic has done has underlined the need for resilient and reliable partnerships and global supply chains. Global supply chains which can withstand shocks and uncertainties. So there is quite clearly a need to reassess global supply chains and over-dependence on one supplier. In the context of COVID, quite clearly we have been a reliable partner. And when the need arose, we stepped up and supplied COVID-related medicines and medical equipment to over 100 countries, including the United States. During the pandemic, our long-standing cooperation with the US in the area of health and scientific research has only deepened further. There has been close contact and exchange of information between CDC and ICMR and several other institutions on both sides. They've exchanged notes on therapeutic and diagnostic aspects of COVID-19. I am aware of at least 3 Indian companies which are collaborating with US partners to develop potential vaccines for COVID-19. The US pharma company Gilead has granted licenses to 7 Indian companies to manufacture remdesivir. They had also worked in the past with Indian companies to export drugs to combat HIV and hepatitis. As you know, we are very strong in producing affordable, good quality medicines and vaccines, meeting up to 40% generic medicines demand in the US and 60% of the vaccines demands globally. In the US context, generic medicines exports by some estimates leads to savings worth $90 billion in the US healthcare expenditure. What I would like to underline here is that India has the necessary capacity, capability, and scale to manufacture vaccines once developed to meet the global demand for COVID-19. I would also like to say that some of the developmental initiatives taken by the government and Dr. Indu Bhushan has already talked about the Prime Minister's Jan Arogya Yojana in great detail, so I will not repeat that. But apart from that, schemes like financial inclusion, as well as strengthening last mile delivery of health services in the country, all these taken together lay the foundation for sustained growth in the healthcare sector and of course opens up new opportunities for private investment.
Thank you very much for your very exciting insights. I think we all realize the strong trade and investment relationship that exists between our two countries. Rakesh, can you share your insights regarding the contributions of the private sector to the Indian healthcare industry?
Rakesh, you're on mute, I think. You're on mute. Rakesh, you're not there. Good.
I'm sorry. Thank you, Samuel, for inviting Abbott to share the perspective. I also want to thank USIBC, specifically the Life Science Division and the entire team of Nexdigm. This is a very important subject, and the context is very timely when we are going through the pandemic situation. And this is absolute honor to have Dr. Indu Bhushan and Consulate General Amit Kumar on the same panel where we have an opportunity of sharing our perspective. To give you a little background about Abbott and the presence of Abbott in the country, you know, we have over 100 years of history with India. We are significantly invested in pharmaceutical, therapeutic nutrition. We are doing quite a bit of medical devices and diagnostics, significant employer in the country, and we have actual stakes in the entire spectrum of the healthcare business in the country. We are facing a very difficult time at this point of time. In fact, this is the biggest healthcare challenge of the century. COVID-19 is rapidly transforming global economies and has a very significant impact on the healthcare delivery system, healthcare regulations, and how various healthcare stakeholders are going to collaborate to address the issue and find a sustainable solution. We have just heard quite a bit from Dr. Indu Bhushan and Mr. Amit Kumar, the kind of the work which is done, and the investment of the efforts Government of India has done during the COVID period to ramp up the healthcare infrastructure from being deficient to being surplus in many areas through a very well-defined action plan. Given the diversity of our country, the responsibility of building a healthier India, I believe cannot be only on the government. Private sector must share it. Over the years, the private sector has made significant contribution in the area of the generic medicines, healthcare infrastructure, devices, diagnostics, and so on. More than ever, now is the time to collaborate between the government and private sector. And there are multiple areas, including our flagship and the biggest healthcare outreach program, which is Ayushman Bharat. Recently, Director General of WHO said, and I read, COVID-19 could be an opportunity for India to speed up the world's largest healthcare scheme, Ayushman Bharat, specifically with a focus on the primary healthcare. And this is absolutely correct. The fight against COVID-19 has already led to multiple changes in the Ayushman program, and we hope to see further adaptation as the healthcare landscape changes in the country. As government is scaling up the testing and the containment efforts, the country will need to increase number of quarantine units, isolation centers, and ICU beds in COVID hospitals. It will also need to ensure increased and continued supply of essential medical products like testing kits, masks, PPEs, oxygen, ventilators, etc. And I'm highlighting just a few. During COVID period, industry has made significant contributions in all these areas. A lot of work has been done and still going on. We are working towards finding a vaccine, and we are working towards the therapeutic areas. Mr. Amit Kumar has just alluded to some. Coming back to Ayushman Bharat, this is about to complete 2 years in September. We have been associated with Ayushman Bharat since the inception. Dr. Indu Bhushan will remember the kind of the work which we are doing with NHA team on building the capacities in a couple of states. During this time, and we heard 11 million beneficiaries have already availed treatment under the scheme. This has been outstanding work done by NHA with Dr. Bhushan in the lead. Data also shows that over half of these 10 millions have been contributed by the private sector, with almost 60% of the total reimbursement coming from the private sector. With this background, and to answer your question, both public and private sector healthcare services will need to collaborate and expand several folds. To continue strengthening countries' response to COVID-19, scale up testing efforts, work on vaccines, and supporting drugs, which will be most needed during this time. We also need to ensure that safe healthcare services are also available to the patients who are suffering from other chronic ailments and non-communicable diseases, which is absolutely critical. So in summary, industry has not been missing in action during the most critical time and will continue support. Collaboration is the key word way forward. I'll stop here.
Thank you. Rakesh, I'm sure I speak for everyone in wishing Abbott continued success in its research efforts to fight COVID. Thank you for all the work that your corporation is doing. Sartek, coming back to the PMJ, we would like you to give your comments on the scheme. Also, specifically, we would like you to cover the impact of technology on healthcare and how technology can be used to deliver quality outcomes under this program.
Thank you, Sam. And first of all, I want to thank Nexdigm for having me here this evening. So it's an absolute pleasure and privilege for me to be on the same panel with Honorable Dr. Indubhushan and CG Amit Kumar. So I think at the outset, once again, I would like to congratulate Dr. Indubhushan and his team. We just recently read about this very fantastic milestone been achieved of serving more than crore patients. So this is fantastic. And I think as Rakesh also said, we've not even completed 2 years of this program. So this milestone, I'm sure, is very important. And I think it speaks of the strong intent of the government behind this program and also the dynamic leadership of Dr. Indubhushan. So, hats off to the team to pull this off. We've also seen the government, taking a lot of feedback from different stakeholders and making improvements along the way. So we also saw very recently, very interesting announcement about the launch of hospital ranking dashboards, based on user experience. I think that's been a very fantastic development. And again, it's a great example of how you can deploy technology to drive evidence-based decision making, for enhancing quality measures. So again, we are seeing great examples of technology being put to use. And I think it was an absolute pleasure again to hear Dr. Indubhushan talking about, how his office has been mandated to launch the National Health Digital Mission. So very clearly, I think technology is going to be at the forefront, Sam, as we move forward. And if you look at the times what we are living in, COVID, I think this is where we all appreciated the value of technology, because suddenly the world changed and all of us had to embrace technology. And now we are all realizing that we could have actually utilized technology in a much better way in the past world what we had. But nevertheless, I think it's a great start. And I think if I have to really talk about technology, I think if we deploy technology in the right extent, we can actually bring out a transformation in the healthcare management in India, and we can actually leapfrog many countries, in terms of where we are. So we all know that technology can be used for screening and diagnosis, and this is very much required for a country like India, where there's huge leakage between the number of patients who suffer from the disease compared to the number who get diagnosed. We are seeing now technology being deployed to study the spread of COVID in terms of surveillance studies. We have seen technology can be used for digitizing records, and Dr. Indubhushan also mentioned about this today in his opening talk, that how they want to look at AMR. And once you have this database, I think what you can do with the database is also very interesting. Obviously you can start measuring outcomes so that you can check how the output of the system is. And not just that, I mean, with artificial intelligence, you can start predicting outcomes. So that's going to be interesting over a period of time. So I think in short, if I have to say, Sam, technology definitely is going to help us leapfrog the way we are managing healthcare in India. And that's what required, because there are a lot of inequities in our healthcare system. We don't have enough hospitals, doctors, and so on. So that's going to be very important. And this whole Ayushman Bharat is actually driving us in the right direction. So I think I would just stop there and just say that, it's very heartening to see the digital reforms because they bring in the much needed transparency, and also it enables all of us to make data-driven decisions moving forward.
Thank you, Sarthak, for those valuable insights. And you're absolutely right. We've all begun using technology and realizing the potential of technology, even in routine healthcare consultations now for many of us. So I think this is definitely an exciting area for India to explore further. I'd now like to address a question to Consul General Amit Kumar. Sir, what are your views on the opportunities that can be explored by the Indian investors, given the various measures that the Indian government has announced to attract foreign investments in healthcare? So if you could explain some of the major initiatives for attracting investment, then we could take on a further question about the opportunities.
Muted.
Is Mr. Amit Kumar muted?
No, thank you very much for that question. As you know, in recent years, one of the primary objectives of the government has been to work in a concerted manner to ease the process of establishing business in India, and as well as the ease of doing business in India. And in that respect, the government has taken several regulatory reforms, easing market restrictions for foreign investors, taxation reforms, and so on. However, I think government also recognizes very much that this remains a work in progress. And in the backdrop of the pandemic, as some panelists have talked about difficulties, the leadership is currently focused on economic recovery and revival. The Prime Minister of India has given a call for Atmanirbhar Bharat, or a self-reliant India. Now, the idea is to build domestic capacities and to also be integrated with global value chains and global economy. And the government has also outlined a number of economic and reform measures focusing on issues relating to land, labor, liquidity, and the legal framework in India. And with the broad objective to, again, provide an enabling environment to overcome the difficulties posed by the abrupt slowdown due to COVID-19 and to jumpstart the economic activity in the country. Now, if we move to the healthcare sector, government, of course, has announced its intention to increase healthcare spending to 2.5% of GDP by 2025 from the current levels of around 1.6%. And this, along with other developmental initiatives like financial inclusion or PM's Jan Arogya Yojana, to improve affordable access to healthcare for over 500 million people. All these factors taken together lay the foundation for sustained growth of healthcare sector in India, which the sector has seen double-digit growth for the last few years, and I think this trend will continue. The overall size is expected to be around $375 billion by 2024. Now, the government has also announced incentives for pharmaceutical and medical devices industry to further strengthen domestic production in India. These production-linked incentives are worth $1.35 billion for manufacturing of APIs and $500 million for the medical devices industry. And as many of you would have noted, the government also announced specific measures in pursuance of the earlier announcement to promote production of bulk drugs and medical devices earlier this week. India is a major producer of generic medicines, but we are also critically dependent on imports of basic ingredients, and the initiative is aimed to reduce this dependency. In the medical devices area, the initial focus will be on expanding manufacturing of cancer care and radiotherapy medical devices, radiology and imaging medical devices, anesthetics, and cardiorespiratory medical devices, and all implants. So I think all these factors taken together, where the government is trying to support growth of the healthcare industry, I think provides enough opportunities for private investment, including foreign investors, to very seriously look at emerging opportunities. And I think companies which make the move now will certainly have the first mover advantage in the years to come. Thank you.
Thank you, Consul General. I think you've also covered much of what I thought of asking as a follow-on question. But is there anything you'd also like to highlight about the tax rates? Now, I think we have a very good tax rate and other incentives as well. So is there any areas there you would like to talk about?
No, no. Of course, government has of course come up with tax very liberal and very attractive tax rates for new investments for new greenfield projects. So that is of course there. But if you allow me, I'll just also say that in terms of investment routes for the healthcare industry, there is 100% FDI available through the automatic route for greenfield projects in the pharmaceutical sector, as well as for medical devices and healthcare industry. In terms of specific figures, if we were to look at, we expect pharma sector to be worth $100 billion by 2025. Medical devices to be $50 billion. The healthcare infrastructure, the hospital infrastructure to be around $150 billion. So again, I think there are a lot of opportunities there. There is another issue which some of the panelists have earlier referred to, both Dr. Indu Bhushan and Mr. Sarthak Ranade, which was how the pandemic has fast-tracked adoption of technology. And I think digital connectivity is being effectively used for medical consultations and diagnostics. It is also being used for healthcare infrastructure management. And I think this trend will continue. It will be the new normal even beyond the pandemic, and certainly contribute to our efforts to expand healthcare to rural India and even other remote corners of the country. So from that perspective, I think, again, there are a lot of opportunities that foreign companies can certainly explore. We, of course, from a broader political perspective, I would say that not only there is tremendous growth opportunity in India, in the healthcare sector, I think there will be a greater, acceptability and push coming from a stronger US-India strategic partnership in the coming years. And I do certainly hope and welcome that US companies will seize this opportunity. Thank you.
Thank you very much, Mr. Kumar, for those very good insights.
Mr. Kumar, one other very exciting development that's happened in recent years is the significant improvement in the world ranking for India and ease of doing business. I think that's another factor that will be very exciting for companies that are looking to do business in India.
That is correct. I think we have jumped substantially in terms of the World Bank ease of doing business rankings. But as I said, this is a work in progress, and the government in the last 2 to 3 months have announced several reforms in the areas of land, in land acquisition laws to manage to provide liquidity in these difficult times, and have also tweaked, certain provisions in the Companies Act, and also extended the period for economic default and those sort of things to provide temporary liquidity and to let economic activity continue. So I think government is, really focused on doing what is necessary to further improve our attractiveness, as well as to have pave the way for more sustained growth in the future.
Thank you. Thank you very much. Rakesh, building upon the discussion so far, what plans are healthcare companies such as Abbott putting in place to capitalize on these new opportunities?
Is Rakesh on mute?
Mr. Chitkara, you're on mute.
I got it.
Thank you.
Thank you. Thank you once again. This is a good question. I guess the way we would really look at how to look at new opportunities and what private sector, and specifically like company like ours, should be participating in the new opportunities which are being created by Ayushman Bharat, and now with COVID situation, which is a very unprecedented time. As we know that government is stressing from the COVID perspective, stressing on the 3T strategy, which is test, track, and treat, with ICMR in lead. We are one of the global leader as Abbott on the diagnostic technology, and we are contributing significantly the way ICMR is developing the protocols and the thoughts going forward on the diagnostic strategies. I'd like to focus on two areas. One is on the diagnostic side, and the other one is on the drug side, where we are focused at this point of time. We have started supplying our lab-based serology tests for detection of the antibody IgG in India. The test identifies if a person has had the COVID-19 in the past. This is in line with ICMR recommendation for the use of IgG test for serosurveillance. Abbott tests can be used for highly reliable, large-scale antibody testing to understand the spread of high-risk population, such as healthcare and the frontline workers, or those who are in the containment zones. We are already in the process of delivering the antibody tests in 8 states of India, specifically to government and private hospitals. And these states include Maharashtra, Uttar Pradesh, and some more. That's one part of it, you know. And the second part is on the supplies of the essential medicines. I guess in terms of, if you look at the opportunities, one is the area where you really supply into the core COVID treatment, you know. The other area is making sure that essential medicines which are used for the immunity building, are adequately supplied, you know. We have ensured that major essential medicines remain available all across the country, despite the fact that we have huge dependence on the imported APIs whose prices have gone up significantly. To give you an example, vitamin C, where our dependence on the imported API is very high and the prices have gone significantly up. At the same time, the demand has gone multifold in the country. This is a scheduled product. The price of this is controlled by the government, and we are actually making all the efforts that that availability of this vital vitamin is available all across the country. So there are many areas where we are working, but I think these are two key areas where I would like to highlight at this point of time.
Thank you. Thank you very much for those comments. Before we move ahead, we have another poll question for the audience. What are the business drivers when you think about healthcare in India today? And please choose from all three of them if they apply: diversify supply chain, new market penetration, and cost competitiveness. And a reminder to submit questions if you have any after this webinar in writing. The results indicate the first two factors, diversification and market penetration, are leading the way as far as potential investments opportunities. I would comment that Hollister Incorporated built a manufacturing plant in Babel in 2007, and all three of these factors were important considerations for us. So thank you very much for participating.
Dr. Bhushan, as you mentioned briefly in the discussion, it's been 2 years, since the rollout of the Ayushman Bharat initiative, and it's been immensely successful in supporting these targeted beneficiaries. Even so, I think the potential in India is still much greater than what we have right now. So what we would like to understand are what are the key learnings from the 2 years of implementation, and what do you see as the way forward for this scheme? Dr. Bhushan, you're muted, I think so.
Sorry.
Thank you.
Sorry. So we are not still calling it a success, and I'm very wary of this adjective that we are successful. We still have a long way to go, and it's only the beginning. And so no scheme of this complexity can be success. So is that several lessons coming out, and we have someone mentioned huge database, and we are constantly doing analysis for policy, and how also to see how we can improve the scheme further. And what we find, of course, no surprises, that awareness is the key, and we still need to deepen the knowledge and spread of the scheme much more, especially in northern states where we still have a lot of work to do. Second thing that we are seeing is that continuum of care is important. It's not the curative services have to build on the other leg of Ayushman Bharat, which is health and wellness centers. Government is planning to put in place 1,000 health centers, and the connection between Ayushman Bharat, PMJ, and health and wellness centers, both for referrals but also after the treatment follow-up, is extremely important, and that needs to be further strengthened. And then finally, two things. One is about the supply, and we still find that supply is a big constraint. States and districts where there is a good supply of hospitals, we are seeing a great uptake. But where there's not a good supply, we find it's a vicious circle, that because there is not good supply of hospitals, uptake of scheme has been slow. Because uptake is low, knowledge about the scheme is low, and since knowledge is low, of course, uptake is low. So one has to invest heavily in these areas where which are underserved, and that is needed now than ever before, because we have a demand in these areas. Earlier there was no demand, people couldn't pay. Now people can pay and they're demanding services, but we need supply. And finally, the quality of services. While this is a scheme for poor people, but not for poor quality services, and ensuring that services which we provide are quality services has been a challenge, and we want to continue to work on that to ensure that quality standards are met. Thank you.
Thank you for the very well-rounded approach to policy decisions. I'm sure the audience is interested in responses from our private sector. Kartik, what are your views on next steps to expand access to new segments in our journey to provide universal health coverage? Are there any learnings from other countries in the area of health financing that you can share?
Thanks, Sam. And I think I'll just go back to the current situation in which we are living, and just want to lay that out that when pandemics or epidemics like COVID, what they have sort of done is they have definitely brought investing in health has become a very important topic. And I think in India, we have seen that the investments from the government has been to the extent of 1.2% of the GDP. But it's also heartening to see that the intent of the government is double it as we move forward. So that's going to be very important. And I think we also in the private sector understand that healthcare sort of situation in India cannot be solved only by the government. I think all of us also have to chip in, and that's why companies like Johnson & Johnson which have been committed to India for over 70 years. We continue to work very closely with the government to see how we can advance the healthcare priorities in the country. I think one area which, Sam, we should definitely look at is how do we reduce the out-of-pocket payment when it comes to healthcare expenditure. And countries like India still remain as a far outlier. We still pay around 60 to 65% of out-of-pocket expenses, which we see. And we can learn, actually, we are in a good situation because we can learn from different countries. So for example, on one hand, you've got developed economies like US and Europe, which have invested in building robust healthcare systems, but also they are staring at another problem where they find the healthcare investments are getting unsustainable. Whereas there are certain countries which have started on the journey of universal healthcare coverage, like India, and we can learn something from them. So for example, Thailand is a country from where we possibly can learn something. So there are examples. For example, we know in UK, the whole public health system is owned and operated by, public health by the government with some kind of co-funding. In countries like France and Israel, we have seen they have allowed private players to come in, and of course, there's a co-funding model or co-pay model. I think India can look at sort of learning the best practices from different countries and customize a solution which works for us. So, for example, if you look at population is our dividend, right? And we can use this population to sort of lower premium. We can achieve a big scale. We can also look at some kind of co-payment model where the patients, the people pay for some part of it, whereas the rest of that part is taken care by the government. So obviously there's a lot which we can do here. I think I love your polls, the way you're taking it, because very clearly the previous poll talked about, what are the drivers for India, and everyone pointed towards market penetration, because India is such a huge opportunity and most of it is so untapped, and that becomes very attractive for all companies to come in and
Thank you. Thank you very much for your comments. It's clear that there's a strong partnership developed between the private and public sectors in India. Rakesh, as a seasoned industry specialist, what do you think are the challenges for the private sector is currently facing the PMJ? How do you think they can be addressed?
All right. Sam, this is a great question. Thanks for asking this. I would highlight 3 or 4 areas where we believe that industry and Ayushman Bharat or PMJ can enhance the collaboration. First, and very important, is public-private partnership in the healthcare sector. This has potential to play a very important role in successful implementation of the schemes under Ayushman Bharat. What we need is to devise mechanisms where PPPs are or can work in more coordinated manner specifically at the state level. Each state actually is working slightly modified model, and working with each state has become a bit of the complex practice, if we have to replicate one model to the other state. That's one. The second is health and wellness centers. We spoke about this and during previous discussions. Health and wellness centers, or HWCs, form the primary pillar of Ayushman Bharat, sort of gatekeeper to the entire reimbursement scheme. HWCs have demonstrated that the creation of a strong primary healthcare system closer to the communities are extremely critical to the delivery of essential healthcare services. These HWCs provide opportunities for the private players to jointly work with the state governments, either to upgrade the primary healthcare centers to HWCs or creating the new health and wellness centers. So that's second. The third is capacity building, and I alluded in my previous comments, what we are doing, and some of the American companies are already working with the NHA in a couple of states on the capacity building programs, and I think more need to be done in that area. Last one, I think critical from the industry perspective is the package rates. In order to empanel more private players under Ayushman Bharat, we know NHA has been actively monitoring and revising the package rates, but low package rates in many cases are still an issue for the private players under Ayushman Bharat. Government must initiate a costing study, we believe, to look into some of the treatment packages that have been flagged as problematic ones. Now, at the same time, we also believe that private hospitals, on their part, need to do their bit, and they must look at creating alternate cost-effective delivery models to participate in the Ayushman Bharat scheme. So I think these are the opportunities where we can enhance our collaboration and reach to the deserving section of the society. Thank you.
Thank you. It's clear that all the initiatives you mentioned will be greatly enhanced by the continued partnership that's being built, continues to be built between the private and public sector. So thank you for that. So Tech, in India, we have consistently had issues with adequate disease diagnostics and treatment to ensure a healthier India. Sartek, will you be able to share your views on how the PMJ and other initiatives are impacting this critical factor, and also how it might impact future market opportunities?
Thank you, Sam. And again, that's a great question. So I think in India we know that if you pick up any disease, typically what we say is that we see leakages along the way. So for example, if you look at the prevalence, the number of people suffering from a disease, and go down that waterfall and try to see the number of people who are diagnosed and who get treated, eventually we see a big drop. So if we say start with 100% prevalence, we get down to a point where we see only 15 to 20% of the patients are getting diagnosed and getting treated. Now that's a big leakage, and that's something which again represents a huge opportunity, because as I said, the domestic market of India can be so attractive if we are able to plug these gaps. And I think programs like Ayushman Bharat are step in that direction, and we heard Dr. Indubhushan saying, it's almost like a new market which is getting created, right? 11 million beneficiaries who were possibly never sort of exposed or access health are now going to access healthcare products and services every year. So this is going to be huge in terms of anyone who wants to come into India and look at investing here. The other thing which obviously programs like Ayushman Bharat and of course the deployment of technology they do is basically they create a ripple effect in terms of the economy, right? And we have seen the number of direct and indirect jobs which have been created because of this demand which has been generated through Ayushman Bharat. And I think in economics we see whenever there is a demand, supply follows. So I think both goes hand in hand, and I'm personally very excited to see this journey of India towards universal healthcare coverage, and it's just going to open more opportunities and make the market more attractive.
Thank you. I certainly appreciate your passion for the subject. Thank you very much.
Thank you.
I would now like to invite our panelists to share their closing comments, starting first with the Honorable Dr. Indubhushan.
Sam, I know I don't sound like Dr. Bhushan, but we had connectivity issues and we seem to have lost him, so we can move on.
Okay.
And thank you for your time, but we can move on to Consul General Kumar, please.
Yes, please. Thank you.
Thank you very much. I think we have had a very good panel discussion today, and I think as one of the panelists spoke of the objective of healthier India, I think we need to, of course, recognize that a healthier India is imperative for us to fully realize the demographic dividend. We have had very comprehensive discussion on the exciting opportunities that lie ahead in the healthcare space. There's of course need for government and private sector to work together to come up with innovative solutions to address some of the challenges that we face, but in particular how to ensure affordable medical healthcare for a vast population while also ensuring quality of healthcare services. So I think the policy space, of course, will keep evolving as we move ahead, and as the consulate, our effort would be to be in touch with all relevant US stakeholders and maintain dialogue with them on emerging opportunities. Thank you.
Thank you. Rakesh, can we ask you to join?
Well, Sam, I think this has been a great discussion, very thought-provoking. The key word and key takeaway, I think, from the entire discussion is collaboration. Collaboration between the government and the private sector is the key to handle existing and the future challenges which current healthcare situation has posed to all of us. So there are no options to work in silos. We need to actually join hands, and that's the way to go.
Thank you very much. And last but not least, Sartek.
Thank you, Sam. And I think, Sam, I would say it's very interesting to see the government making its intentions clear in terms of continue to invest more on healthcare. I think that's going to create a huge market opportunity. And I think, I would sort of close by saying the words of Dr. V.K. Paul, as well as many leaders from the government who say that if you have to make wealthy India, we have to make healthy India. The path for wealth is through health. So, interesting times, and companies like Johnson & Johnson are committed to work along with the government to drive better healthcare in India.
Thank you. Thanks to all of you for sharing your valuable insights with us. The discussion today has been extremely engaging, and I'm sure your versatile experience provides the audience with a very well-rounded perspective needed while they're evaluating their India strategy. So thank you very much for your time.
Thank you, sir.
Thank you. Thank you.
Thank you very much, everybody. We do have questions from the audience, but unfortunately, due to time constraints, we will not be able to take questions from the audience at this time. However, we have got your questions down, and we will respond to each one of you in writing. Thank you very much. Over to you, Mark.
Thank you, Ravi. And that's what my intent will be, is to document those questions and respond as Ravi indicated. So I appreciate everybody's understanding. I'd like to now introduce very briefly here, Guljit Singh. Guljit serves as the Group Executive Chairperson at Nexdigm. With over 47 years of diverse business experience in the global medical device sector, he has a proven record of delivering and sustaining progress while expanding in all geographic markets. At Nexdigm, he's guiding the organization's rapid growth and future expansion by providing necessary leadership for our evolving global organization. Guljit, we're privileged to have you join us. The floor is all yours. Guljit, can you hear me?
Mark, I'm wondering if he, at the very
Hello,
beginning.
can you hear me?
Yes, we can, Guljit. Please, the floor is all yours.
Can you hear me?
Yes, sir.
Okay, sorry, I don't know what happened there. So I won't take much longer, just a couple of minutes to say a few words as the chairman of the firm. We're just about to wrap up our third in a series of webinars on Diversify and Differentiate. This was also co-hosted with us by USIBC, which is US India Business Council. We appreciate their joining hands with us. Today's discussion was focused on the healthcare, a focus sector for Nexdigm. The sector Nexdigm has published several thought leadership articles in collaboration with leading global associations focused on this sector alone. Nexdigm has been helping primarily MNC firms in easing their journey into India for the last almost 3 decades. In the last few days, we heard from US Secretary of State Pompeo that the last 5 decades of the China experiment has come to an end. globalization has taken a hit. However, we heard from the panelists today and in our earlier related webinars, the supply chains will take a long time to get realigned. There will be plenty of explanation. Further, all experts agree that India-US relationship, by all measures, is expected to become the most defining relationship of the 21st century, as it would be a relationship between the largest democracy by population and the richest democratic nation on this planet. It is and will be based on shared vision and values. We have been holding hand in hand with hundreds of small to multi-billion-dollar marquee names, and more so in the healthcare sector. I take this opportunity to thank our global audience, without whom we had no reason to be spending the last 90 plus or so minutes. Hope you found this to be useful. If any one of you would like a copy of this or our previous webinars on this subject, feel free to reach out to us. Let me take the opportunity to thank our esteemed and distinguished panelists, Dr. Indu Bhushan, CEO, Ayushman Bharat, India Healthcare Authority. Mr. Sarthak Ranade, MD, Janssen India Companies of the J&J Group. Mr. Rakesh Chitkara, Senior Director of Abbott Healthcare India. And thank you to our moderators. Mark Lissam, you seem to have become an expert on these now. I know you are joining from Chicago area. Sam Brilliant, joining us from Florida, an extremely accomplished individual who advises our firm at global level. Ravi Menon, another one of our senior healthcare advisors from Bangalore, India. Let me also thank our co-host partners, USIBC, especially Sandeep Maini, working behind the scenes, supporting us. Not the least, let me take the opportunity to thank our Nexdigm leadership and associates who have spent days, if not weeks, putting all this together. They are Manoj Gidwani from Mumbai, Mayank Lakhani from Mumbai, Salil Naran from Delhi, India, Nimesh Shah from Toronto, our US team from Mumbai, Jeev Kohli and Shubham, marketing all from Mumbai, Jugal, Jitin and Priya, for doing webinar platform and invites, designing and script writing, and finally our healthcare team, Herschel and Prateek. If I have missed anyone, it is because of my own oversight. So thank you all. Thank you all for attending this. Appreciate your joining the webinar.
Thank you, Guljit. We invite you all to connect with us for a discussion about how Nexdigm can work hand in hand with you and your organization. If you have any questions that we were unable to address during today's session, please feel free to reach out to us at thinknext@nexdigm.com, and you'll get the personal attention for which we are widely known. Across the globe, we do think next at Nexdigm, and we invite you to do the same. We welcome your feedback on today's presentation. In the meantime, please be vigilant, stay safe. Thank you and goodbye.
Thank you, bye.